Hi, welcome to the Yellow Room. Right over here to the Yellow Room. So this is the Yellow Room where we have the verbal portions of the exams, kit conversions as well as to be able to maintain 6 feet distance from survivors. And here we have the cubby that we have comfort bags that we give folks that we see here, as well as our packets that we give folks. We also even have coffee, water that we can give folks as well.
Back over here is what we utilize for a lot of training. If you want to come over here with me, there is I think it's best shown over here. But there's a whole exam table behind here. It's not set up right now, but this has an ability I use this for training new nurses. There's something called a colposcope under that white sheet over there. We have some extra training kits and just some extra equipment that I utilize for precepting and training. This is a office area over here. We can print and do all that kind of thing. There's a bathroom that patients can use back here. In here, there's a lot of different, patients can come in here and there's a lot of different things that they can utilize as far as toiletries, deodorant, toothbrushes. We try to set up each bathroom to where if a patient will come in, there's everything that they need for them. So we can come back out. I should just, yeah, I know. And I think the other thing, a lot of this stuff is storage. So in these, areas behind you, there's storage. And in those yellow cabinets is storage. In the green cabinet over there is storage.
Welcome to our Eloise House tour. This is our first clinic. So this was built here in 2015. It's a pretty cozy clinic that we have for our survivors. We have a couch, we have a weighted blanket, a bunch of things survivors can hold, stress toys. So yeah, we have some stress toys here for survivors if they need something to fidget with or have in their hands. This building has 2 rooms. The first is a smaller exam room. So this is our exam table. This is our colposcope. So this is a more traditional colposcope that we have here. It does take photos, but this helps us magnify and visualize the anogenital area. And then we do have a couple things in this room. Usually we use the bigger room on the other side, but in this room we have, our kits, which are just like cardboard boxes with a bunch of swabs and cardboard boxes inside. The swabs, and this is something that I do like to show survivors, are basically Q-tip ear cleaners. They just have a longer handle for us to hold. And this is what we use to swab over the course of their entire bodies. We have a bunch of knickknacks in here that we use during exams, like chain of custody stickers, rulers to measure injury, and then we give out medications. The medications that we provide are prophylactic medications for sexually transmitted infections. So gonorrhea, trichomonas, and chlamydia, we're able to provide those here, as well as Plan B or Ella for pregnancy prevention. So back in the lobby, this is where we do a lot of the talking with survivors. They're welcome to bring a support person or support animal. Always encourage animals here. And this is kind of where we introduce ourselves, do paperwork, and go through a lot of the medical and forensic questions that we have to go through before we do the physical exam. Over here we have our 2 locked fridges for evidence storage. These are for the kits that patients have reported to law enforcement. And then we also have some storage for kits that patients complete without reporting to law enforcement. So they are all stored here securely. We have law enforcement come and pick up their evidence kits after a day or 2 after the exams. So a couple things that we do offer survivors is obviously water, coffee, tea, juice, ginger ale, Sprite, and then we have a bunch of snacks for them, if they're hungry while they're here. A lot of times we'll get survivors from the hospital who say they haven't eaten in 12 or 15 hours because they were told they couldn't eat. And, we always encourage people, if you are at the hospital, you can eat something. Of course, it can destroy some evidence, but also we don't want you to be starving and dehydrated when you get here. So lots of snacks and goodies for people. This is our bathroom. So in here we have a lot of toiletries and things that we, encourage survivors to take. These include clothing items, socks, underwear, sweatpants, sweatshirts, and survivors can come in here if they've given us their clothes for evidence collection. Obviously we can give them a set of clothes to go home in, or if they're needing extra clothing, we can provide that while they're here. This is our advocacy cabinet. One of the cute things that we do offer survivors are called comfort bags. And they're from St. George's Episcopal Church, and they have like cute little note and candy, little toiletries, notepad, things like that, and a lavender satchel that we provide each survivor who comes here, as well as a big packet of information and resources. And then this is our larger exam room. There are 2 nurses finishing up a case right now, and this is the room we generally use in this clinic. What's unique to this room is that we have this really cool Cortex Flow photography device. So it has a camera on it that we're able to zoom in and out to assess and visualize the anogenital area as well as other marks and bruises on their body. But it pops up on this big screen so we can zoom in and crop photos that are easier to see injury when you crop them. So this is a fairly new tool that we're using, but it's really helpful and gets a lot of great pictures. This is the addition to our first clinic that was built a couple years ago. And there are a lot of cool improvements in this clinic. So this is our little lobby. And we've kind of made this used to be an exam room, and we kind of transitioned it into more of a waiting room and a question area, just because it's a little bigger. We do have a fridge in this one, water cooler, and same as in the last one, lots of snacks. As well as a microwave. So this room is basically just similar to the couch room next door. Make people and their guests feel comfortable. And then we will walk and go see our bathroom, because one of the cool improvements in this building is that we have a walk-in shower. This is our shower that survivors can use if they haven't showered, if they are just feeling really icky after the exam and just want to wash off. We have this available to them, as well as towels, flip-flops, and changes of clothing if they need them. So this has been really helpful, especially for patients who haven't been able to shower in a couple of days. So this is our exam room in We call this building Eloise 2 and the extension of Eloise 1. In here, we have like really nice skylights. It's got a lot of natural light in here. Again, with the Cortex Flow, the machine that we use to assess and take photographs of patients, as well as assess their anogenital area as you would like with a colposcope. During these exams, we do offer speculum exams, so a full anogenital assessment, which would include, a speculum exam to collect swabs from their cervix as well as their vaginal walls and assess for any injury internally. Thank you so much for touring Eloise House, and if you have any questions, you can find some answers at safeaustin.org.